Have you ever felt like you wanted to kill yourself? Do you think that telling someone who's depressed to snap out of it will help them? I've had clinical depression since I was a teenager, and I was diagnosed about 20 years ago. Today, I want to inform you about the different types of depression, the different kinds of depression, and how to treat a few of the most common ones. I will explain to you a few kinds of depression, their symptoms, and ways to treat them. This information I found from Mayo Clinic, MedicineNet.com, Depression-Helper.com, and DepressionTreatmentNow.com. The first type of depression originates from a bad or disturbing life event. It could be a death in the family, you could have lost your job, something to that effect. The second one, which is more common, is that it appears for no apparent reason. It could be genetic. Also, every time you have this, it is always caused by a change in the brain. The first one I would like to talk about is seasonal affective disorder, or SAD. This usually occurs in the winter when it's cold and dark and has very little sunshine. It's the lack of light that affects your mood. Treatment is light therapy, or phototherapy is another name. You are exposed to a bright artificial light, and you sit or work near a device called a light therapy box. It gives off a bright light that mimics the natural outdoor light. Another one is postpartum depression. About 10% of women, after they've had a child, whether it's their first or their second, can experience a severe form of emotional distress. It's more than just the baby blues. It is more intense and it lasts longer. Some of the symptoms are a loss of appetite, intense irritability and anger, overwhelming fatigue, lack of joy in life. They find it difficulty bonding with your child, and then sometimes you feel like you're to harm your child or even harm yourself. It's really important when you feel this to go to see your doctor. Treatment consists of antidepressants, counseling, and also hormone therapy. The next one is a very serious disorder, a mood disorder, and that's called bipolar disorder or manic depression. And these people who have this experience extreme and abnormal mood swings that stay for prolonged periods, and this causes severe psychological distress, and interferes with normal functioning. And this is really important that you see a doctor for this. Treatment consists of antidepressants medication along with mood stabilizer medication. Sometimes you have, besides those medications, you have something called adjunctive treatment, and that ECT, electroconvulsive treatment, which is shock therapy, could also be beneficial for these people. And also psychotherapy and cognitive behavior therapy. Cognitive behavior therapy is talk therapy, where they are coached or instructed in effective methods of coping. This is done in a safe, non-judgmental environment. Another one that I found online was online counseling with real doctors. They charge between $2 to $4 per minute. Some people might find that interesting to use. Another depression is called clinical depression. And depression ranges from mild to serious. But clinical depression describes the more persistent form of depression, also known as major depression. The signs and the symptoms include loss of interest in daily activities, persistent sadness or feelings of emptiness, sleep disturbances, significant weight loss or gain, loss of concentration, fatigue, suicide thoughts and behavior, and sometimes they attempt to commit suicide. Treatment can be in many forms. With most forms of depression, symptoms can improve with counseling, antidepressants, and sometimes a combination of both of these. If it's a very severe depression and it doesn't improve with those treatments, you can use ECT, which is electroconvulsive therapy, shock therapy. That may be beneficial. And there are two newer treatments that are showing very promising results for treating difficult to treat depression. The first one is called vagus nerve therapy, VNS, and deep brain stimulation, DBS. Both of these treatments affect the mood center of the brain with electrical currents that pass through surgically implanted electrodes. And they're both invasive procedures. Another two treatments that were just approved by the FDA. The first one is called transcranial magnetic stimulation, TMS. And this works by using strong magnets to stimulate the part of the brain that affects mood. And the last one is called cranial electrotherapy stimulation, or CES. This entails very low levels of electrical currents across the brain for medical or physiological applications. It's very good because it can help depression, anxiety, insomnia, and even chronic pain. For mild depression, you can try the following. You can eat a healthy diet, exercise, make a gratitude list, smile, get a massage, take a walk, read comics or see a comedy. Laughter is really very beneficial. Pretend to be cheerful. I do that an awful lot. Change your attitude. Breathe slowly in and visualize positive thoughts. And focus on helping someone. That gets you to stop thinking about yourself. Well, I think I'm about out of treatments for depression. To recap, there are two types of depression. There are many kinds of depression that exhibit many different symptoms, and there are many treatments out there that are successful. I hope that everyone here will remember that if they ever feel depressed for more than 2 weeks, that they should go see their doctor and see if it's depression or maybe it's something else, and they should be treated. Also, I know we look at all those commercials where medication is being pushed on us all the time, but it is good to know that there are therapies where you don't need to use medication. You go to see your doctor and you find out what works best for you. Thank you.